Hello, everyone, and welcome to the Collaborative Health Record webinar for health teams. My name is Melissa Wharton. I'm a marketing specialist here at TELUS Health for about 6 years now, and I also have the pleasure of being your moderator for tonight's presentation. We are delighted to have you with us today, and we hope that you'll enjoy this presentation. So without further ado, I'm pleased to introduce today's speaker, Puneet Seth. Puneet, please go ahead.
Thank you, Veronique, and thank you everyone for joining us this evening. Very excited to be taking this opportunity to talk a little bit about the collaborative health record and more specifically about how it can bring a tremendous amount of value in the context of family health teams. So first and foremost, just briefly a little bit about myself for those of you whom I haven't met before or I haven't had the opportunity to connect with before. I'm a practicing family doctor here in Toronto. I've been in practice for about 10 years, having graduated from McMaster University. While I was at McMaster, I had the fortune of training at the McMaster Family Health Team, one of the first family health teams in Ontario, and I continued to work there as an academic family physician. And I've also had an opportunity to work in a variety of other clinical settings as a hospitalist in occupational health, and I currently run a family practice now in downtown Toronto. On the technology side, I've had the fortune of being able to be on the team that initially created a next generation health record system, the Collaborative Health Record, or CHR, that we're obviously here to talk about today, alongside co-founders Dr. Damon Ramsey, who's a family physician at BBC, and now who's Vice President and Chief Medical Information Officer at TELUS, and Sean Jung, who's the Principal Technology Architect of the Collaborative Health Record. And the incredible and brilliant team that we have all across at TELUS Health, and of course at the Collaborative Health team here as well. On top of this, actually, one of the most exciting parts of all of this is the fact that I have and currently have an opportunity to use the CHR in my own practice, and I'm hoping to be able to share some of my own experiences and thoughts as both a user and someone who's been involved in its development. Before we begin talking about the CHR, I'll also add that over the course of the last 8 years that I've been working with the CHR, developing the CHR as well as helping deliver it across the country, I've had a chance to work with and meet colleagues across the country who've been wanting to make their transition from their EMRs or from paper onto the Collaborative Health Record, which has been a humbling and an eye-opening experience. And I think it's really provided even more insight with respect to the tremendous need that we have here today in the context of the pandemic and even otherwise in terms of making sure we have efficient platforms and platforms that help us do the job that we need to do. So first, let's start by talking a little bit about health records and EMRs themselves. So they're, of course, nothing new to those of you who are here on the line. And they've played a very important role in the past few decades in taking us from a paper world to really a digital version of that paper world in healthcare. And we've seen so many benefits as a result of that digitization process. There's been the reduction of paper. There's been real-time receipt of labs and imaging. There's been an easier ability to be able to submit billing and reporting for ministry purposes. But I think it's safe to say that we all know that the paradigm of the EMR traditionally has really been that of the physician and their computer. And we also know in the last few decades that a lot has changed in healthcare. I think the expectations of the public have changed dramatically. And that paradigm of how the health record system works no longer fits the needs of healthcare delivery in Canada and beyond, and particularly of family health teams. So again, I'm preaching to the choir here, but everyone knows about primary care teams, and in the context of Ontario family health teams, the patient is of course at the center. And we know that the teams are designed to be able to support care with a wide array of different interdisciplinary healthcare providers collaborating together to be able to deliver the best possible care to a given patient. We also know that with family health teams and similar and related models, whether they're models in family health organizations or of course in now the evolving OHTs, there's geographic changes as well. It's not just the idea of all clinics being a solo practitioner working by themselves in one location or with an interdisciplinary team in one location. Now we know that family health teams, family health organizations, OHTs involve really teams of healthcare providers working across a jurisdiction, perhaps across multiple different physical clinics, and also across the fact that we now need to incorporate the virtual reality of the fact that we need to deliver care when patients are not able to be in front of us at a given time. So simply put, we need tools that help us work better together. And that requires us going back a little bit to the drawing board, which is what we had done now well over 5-6 years ago now when the collaborative health record was first developed. And we need to think about software that works for care teams, that really is designed to be able to allow us to focus on building a system that is designed to enable care delivery, that's designed to be able to enable engagement. And in doing so, that provides a better glue that facilitates and binds all the different players of the healthcare team. So lo and behold, and this is where the virtual drum roll comes in, the collaborative health record. And this is really what we've accomplished with the CHR over the course of well over the last half decade. A modern cloud-based platform that allows patient and care team to work together towards better health. A recent addition to the TELUS Health family, the CHR, is a paradigm shift in how we think about electronic health records and is presently being used by thousands of colleagues across the country, a variety of different healthcare providers, and of course, substantially in primary care as well. Importantly, it's a true cloud-based solution, so there's no proprietary software that needs to be installed on local devices. And before we actually explore the CHR a little bit further, let's take things back to the patient. So at TELUS Health, we've been wanting to really bring the patient story and the patient narrative at the core of everything that we're doing. And I think there's no better way to tell the story of the CHR than through a patient story. And this is, of course, a pseudo patient based off someone that I've seen in my own clinic that really helps highlight the complexity and the realities of what we see on day-to-day practice. So this is George, a 59-year-old gentleman who presented to my clinic with issues regarding his weight, low mood, a recent diagnosis of diabetes, ongoing problems with sleep apnea. You know, he'd been his family physician of many years had retired well over a year ago. He was left without a primary care provider, kind of hopping between clinics, as many patients end up finding themselves in, and also finding his way in and out of hospital. So he presents knocking at my clinic in Toronto, seeking help and seeking, of course, much more than I could independently deliver to him in the 10-15 minutes that we spoke. The reality is that George needs a team on his side. Being able to provide him everything that he needs is not something I can, of course, do independently. I rely on the fact that we have a diabetes nurse in our clinic. I rely on the fact that we have nurse practitioners that are available to be able to help. I rely on specialists both within my practice as well as those within the community, dietitians, other healthcare providers. Somebody like George would, of course, benefit from somebody like a patient navigator. Unfortunately, I didn't have one accessible to me. But this really represents the fact that, again, healthcare is complex and it's a team-based sport. And thinking about how to meet George's needs requires us to think about the team and how the team can work together. So now let's talk a little bit about how the CHR fits into being able to support care for somebody like George. So at its core, the CHR understands that a healthcare team or a healthcare delivery involves more than one type of player, especially when we talk about healthcare providers. And as a result of that, the CHR allows organizations to be able to build their own roles. And you can see that on the left-hand side with the dietitian, the MOA, pharmacist, physician, social workers. And you're able to customize and build the necessary permissions that each of these different roles has. We also know that the reality is that from clinic to clinic, practice to practice, community to community, different people define those roles differently in terms of who has access to which records or who can prescribe and who can't, and who can edit and encounter note and who can't. And the CHR provides that versatility of being able to not shackle an organization to define a healthcare provider in a certain way. So rather than just abstractly talking about the CHR through pictures, what I'm actually going to do is flip my screen here a little bit to the right and actually give you a brief sneak peek of the collaborative health record. So first of all, for those who haven't seen the CHR before, this is indeed the collaborative health record. I'll start off by orienting everyone to a few of the things that you're actually seeing on the screen. First of all, again, it's a cloud-based platform. So I'm accessing this through my Google Chrome browser. The only requirement that we have for those accessing the platform from the clinic, from the healthcare organization side, is that you're using Google Chrome, both for security as well as functionality purposes. And I can see here in the top left-hand corner that I'm logged in, and I see that I have the ability to change the location that I'm logged into, as well as access different elements of my profile. On the left-hand side, you can see different icons that pertain to different functions of the platform. We, of course, won't have enough time to go through each of these today, but just to know that navigation of the platform is as easy as clicking on those icons and flipping from one screen to the next. So you're not lost in a myriad of different pop-up windows and things opening up. This is all succinct and kept within your browser screen. Right now, what we're looking at is actually the patient chart. So we're in the patients section of the CHR. And specifically, I'm looking at the what we call the dashboard, the patient dashboard. So this is a customizable view that allows users to be able to see quick pieces of relevant information and elements of quick action associated with the chart. You can also see that there's a Start Open button here that allows me to quickly navigate to different parts of the chart that I might need to access. Importantly, what I wanted to point out is this idea of the care team. So right from within the dashboard of George's chart, you can see George here, I can see that there's a variety of different care providers that are involved within this circle of care for George. This includes respiratory therapists, nephrologists, endocrinologists, family physicians, psychiatrists, allied healthcare providers, and so forth. And the neat thing is I can not only see who's involved in the care team, but by being part of the care team, when a visit takes place or a progress note is created or a letter is created, I have an ability to be able to communicate with all those team members, both members that are actually part of the CHR and that are actually on this account, as well as those that are external to this and maybe working at a different practice, but being able to send notes and updates to them as well. In addition, what we're able to see through the idea of different roles, and I'm going to switch briefly to the settings section of the platform, just to briefly illustrate the fact that you can see how different roles can be defined here. So I can create different groups. So I can have an allied health team, a medical team, group of clinicians, and I can actually create roles. So now let's say, for example, that my clinic was fortunate enough to get a patient navigator. I complained about that as a result of not being able to have this for George, and lo and behold, we were able to find funding for a patient navigator, and I can define what specific permissions that a patient navigator would actually have, whether they can access certain parts of the platform and so forth. So this is just an incredibly versatile way to be able to have both evolving care teams as well as evolving roles that we know that healthcare providers have, and CHR is built with all of this in mind. So I'm going to switch back to the slide deck here, including George in the journey. So an important part of the fact that the CHR is indeed collaborative is the fact that it's collaborative with the patient included in the process. So this means that George has a variety of different ways in which he can connect with myself and connect with the care team as appropriate and as per permissions we've provided that allow us to be able to provide the best possible care, that allow for efficiency, and that allow for access that's particularly needed in the context of a family health team. So what does including George in the journey really mean? What it means is that the CHR has a variety of different patient engagement tools. In fact, you can think of any way in which anyone in the public can access, for example, food, or they can make a reservation for a hotel, or any way in which we interact with other industries. The CHR provides different patient engagement elements that are directly connected to the system that allow for a clinic to be able to use things like online appointment booking, digital consent, patient education, intake questionnaires, messaging, file sharing, virtual care, all of these within the platform without having to leave the system, without having to use any additional third-party software. So it's an all-in-one platform. And this means that when George is interacting with me through the platform, I'm able to benefit from the fact that this information is coming directly into George's chart. And whether it's something like, for example, tracking his mood scores, because I was concerned about his recent diagnosis of diabetes and the fact that he's socially isolated. I asked George to be if it would be okay if we could send him a pre and post visit questionnaire, perhaps track his mood scores over time. This information comes directly into George's chart, and this means a powerful way to be able to visualize how George is doing directly from within the record. So let me illustrate that really briefly here. So at the core of the collaborative health record is, as I mentioned, this idea of Q&Rs or digital health questionnaires. So the CHR was actually started as a patient engagement platform. And at the core of this was the ability to not only leverage pre-existing tools that were already built, but also to be able to actually build additional tools and allow organizations to have the necessary control that they need to engage their practices. So if I look at, for example, the case of, let's say, asthma, I'm able to actually see here, and this is a rendering of what it would look like if this Q&R or digital health questionnaire was sent to George. It could be sent either via SMS, via email, or through a connected patient app. And George would be able to respond to these questions in a simple and intuitive format based on the questions that are there. Importantly, Q&Rs are actually built with the ability to be able to create what we call branching logic or dependency logic, meaning that one response actually changes the series of subsequent questions that are asked. And this allows for fairly sophisticated triaging to take place through the platform. There's about 15 different response types that can be programmed into these tools. This is, of course, a demonstration tool. But the idea is that this information is being collected in a structured format. So George is able to share his information about his health directly through the platform. And the platform is able to understand that this is patient-reported information that's able to come in and able to synergize with his note. So if I look at George's chart, for example, and I can see that George may have completed some pre-visit questionnaires, you can see, for example, that a diabetes questionnaire was provided to George because George had a recent diagnosis, and it was determined that was the reason for him coming in for care. And we can see that not only was the platform able to ask the necessary appropriate questions, but here's the important part. It's able to make that information available in a usable format and in a meaningful format, which is that it's able to convert it into clinical language. So what does this actually look like in the context of an encounter? So let's briefly switch to the encounter section of the platform to be able to demonstrate what this might look like. So if George was coming in for a diabetes visit, and George would be able to ebook this diabetes visit online, what the platform is able to do is it's able to know that George should have had a diabetes intake questionnaire automatically completed. That information is able to pull in. And because it's a diabetes visit and a diabetes encounter template appears, and it pulls in all of the necessary information. So it's combining George's responses from a questionnaire with the existing data that's available within George's chart and providing a clean and summarized visualization of what's happening. I would then, during the course of a visit, have the ability to be able to interact with configurable parts of the note, what we call instant variables. So for example, I was reviewing his exercise, and he was mentioning he was doing both aerobic exercise as well as strength training. I can click and select these, and it's not only entering this information in an easy-to-use format, but I'm also getting structured data that can be utilized as well. So that's just a really brief overview of the fact that patient data, patient responses can flow meaningfully directly into the clinical note as another way in which we can actually engage with George. A platform for all care delivery. So one of the things that we know is, of course, and again, everyone here has utilized virtual in one way, shape, or form over the course of the last now almost 2 years, whether it's making phone calls with patients because of the pandemic, whether it's messaging the patient through a patient portal or through a different tool, or whether it's actually doing a video visit. The incredible thing about the CHR is that it provides everything you need to be able to provide the right type of care for your patients within the platform. So there's no need for a separate virtual system or a separate e-visit system. It's all in one place, which means securely being able to deliver the necessary type of care. Importantly, we also recognize that a lot of the times what we need to do on a day-to-day basis is not necessarily always hop on the phone or even need a video visit. In fact, I would say in my own practice, I tend to use video visits very rarely only in those odd situations where I got the patient to take a photo, for example, through a Q&A and it wasn't good enough and I kind of needed to see a rash a little bit more closely or certain specific circumstances. Otherwise, a lot of the time, virtual care for myself actually means simply having had for example, a cold intake questionnaire gone out to a patient, being able to review those responses and provide the necessary care back to the patient or ask additional questions through a patient portal. The CHR provides patients to be able to interact with the CHR either through a web-based application, so they can, and important note, patients don't need to use Google Chrome. They can access the patient portal through any modern web browser. And importantly, they can also access it through a native Apple and Android application that's available to them as well, that can allow them to securely message, receive files, receive tasks, and engage both in instant chat as well as video or audio visits. So what does this actually look like? So let's say in the context of George, I might determine that at the end of a visit, I want to message George and I want to send some information to him. Directly from within George's chart, I'm able to message him and I'm able to select a specific template. So perhaps I need to tell him that his lab results are normal. And there's a template I've pre-created for this. Now I can simply attach a document from within George's chart, and this would get sent to George through the platform. Importantly, you can see that this allows me to be able to specify whether or not this is a message in which I'm opening a conversation with George. Perhaps I want him to be able to respond because I want to know whether or not he had any additional questions, or maybe this is just unidirectional and I just want to send information and I'm not trying to initiate a conversation. I can appreciate how important this is in the context of an FHT because as we know, billing models allow us to be able to carve time out to be able to engage with patients through this manner. So we're not necessarily always tied to the same fee-for-service model where something like, for example, responding to messages through a portal may not make sense for those in fee-for-service. But again, in the FHT, OHT, FHO models and others, there is this ability to be able to leverage the platform to deliver the best possible care that's needed at the time. So that's an example of patient messaging through the chart itself. You can also see that, importantly, within the platform, there's the ability to be able to engage in instant chat as well as video visits. So I'm quickly going to switch to a different demo account that I'm logged into, one that's connected to an application. So this is with a patient conveniently named Deborah Diabetes. And you can see here that there's a virtual visit pathway, which is essentially your interface to be able to engage in a virtual visit that's directly within Deborah's chart. So the left-hand panel, I can see that there's a pathway that's open. This is the pathway for the virtual visit. And on this side, I can see that I'm able to see Deborah's chart. I could go into an encounter. I could look at her medical history or other parts of her chart while still being able to interact with Deborah. And I can interact through either having tasks that need to be sent to the patient, for example, watch a video or read this patient content. We can actually define what these actions or tasks are for patients, and also to make sure that these things are being completed. Similarly, on the staff side, and again going back to the collaborative nature of the platform, you can assign and pre-configure these tasks that need to take place before, during, or after a virtual visit, for example. Really briefly, you can see here that I'm able to chat. And this securely will be sent to Debbie. And then last but not least, we're actually able to initiate a video chat if needed as well. Also notice that the platform actually does an automated check for the camera, mic, and notifications. So you can actually see here that the patients installed the app. They were last active 5 months ago, but their camera, microphone, and notifications are connected. So a really quick way to screen for some of the common issues that take place. So now I'm actually going to call not Debbie, but one of our team members who's on this call as well, Allison. And as you can see here, I can see Allison directly through the platform, and I'm able to engage. And right now, because the video is connected to this WebEx, I'm not able to share my video, but normally you'd see my video screen here as well, and I can interact directly with the patient while, again, I'm using the chart, reviewing their labs and so forth. Thanks, Allison. So again, incredible power of being able to access virtual in a meaningful and secure way directly within the CHR itself. So reporting as a team. We know that with family health teams, one of the joys or burdens, if you will, is that it comes with a substantial amount of operational and clinical reporting that needs to take place, whether it's chronic disease related, whether it's prevention related, whether it's billing related, and in the future potentially outcome related as well, where there may be the need to be able to report patient-reported outcomes or clinical outcomes as part of these as part of the necessary requirements. Having worked with a number of family health teams within Ontario, we've already built and customized a number of the standard reports that are required. Importantly, we also allow the ability to be able to customize these reports. And importantly, these are real-time and interactive reports that are available within the system. Really briefly here, I'll go into the sandbox and load a couple of reports. The CHR actually has a built-in analytics engine that is accessible within the platform. So again, you don't need to leave the platform to be able to access this function. And you're able to see, now this is a list of some of our common pre-templated reports that are available. And of course, only users with appropriate permissions would be able to access this. But let's say I wanted to look at something standard, like what type of appointments have taken place over the last 90 days. You can see here that there's a number of different filters available to me. I could filter by the number of days, which practitioner, and I even have a drop down. If I'm looking for myself, I can search for myself. If I'm searching for my colleague Damon, I can search for Damon. Or maybe I want to search by appointment types and so forth. So these are customizable filters that you can search by. And then I can run the report. And in running the report, and it'll take a couple of seconds to load, in real time, it's going to produce the live report of information in the system. So I can see there were 126 appointments that took place in the last 90 days. A handful of them are actually still in the confirmed state or in the book state and haven't actually taken place. Fortunately, there's none that are canceled. There's no no-shows. Things have been great. And because patients have notifications that they receive through the platform, again, it dramatically reduces things like no-shows. I can see what presenting issues, abdominal pain, acne, another common one being headache, that has been the presenting issue or a reason for a visit, what appointment types have taken place and so forth. So this is just an illustration showing the types of reports that can be generated. And the power is really that this is interactive data. So if I wanted to look at which of these appointments are ones where the patient is still in the room, I can click on this and it'll actually produce a table of this data. I could download these results and take actions from these. I could even hop into a patient's chart directly from the analytics report as well. Another couple of important reports that I wanted to show here, just to showcase the power and the utility of the system. One is relating to Q&Rs. So as you know, Q&Rs are collecting patient-reported data over time. This can be a fantastic way to actually track outcomes associated with the care being delivered. So if, for example, we look at the depression self-assessment, in the last 90 days, let's look at what the depression self-assessment scores have been. Okay, actually, this is not a great example because there's not a lot of data for this particular tool. But you can see here that what I'm actually able to see, and let's actually hop into this account and load it here so there's a little bit more data. But what I want to be able to show is that you can see the change in that information over time. and you can actually visualize how those outcomes are changing. And as a result of that, you're actually also able to see how certain interventions may have changed as well. So let's try the depression self-assessment here and see what happens. Okay, actually, not a lot in this one either. So let's quickly try this one. And if not, then we'll move on. But the power of this is, let's say there's a new counseling program that's been provided through the FHT. You can now see what the changes in scores may be associated with that program, and actually track the clinical outcomes that take hold as a result of that. Last but not least, one of the other incredible things that we're able to do through this is also mass actions. So what this means is that we could search for patients on the basis of when their last appointment was, what their age, gender is, what particular status tag may be affiliated with them, what diagnosis they have, whether or not they've, for example, had a colonoscopy in the last year, and their age is greater than 50. And what you can then do is actually take actions directly through the CHR. So you could, for example, send a questionnaire, and the questionnaire could actually have built-in video and education around the importance of colon cancer screening for all patients that have a colonoscopy due and that have been overdue. So it allows you to actually take population health level actions directly through the reporting system. The CHR also recognizes, as I mentioned before, the fact that we now think of care in a much more distributed fashion, whether it's within a context of a care team or across jurisdiction. So multiple clinics are often collaborating together to be able to deliver care. They're perhaps part of the same group or network. And the CHR has the capability of being able to be a single platform across an array of different physical or virtual locations. This is incredibly powerful in the context of things like FHTs and Ontario Health teams. And we've been able to demonstrate our capacity to do this in relevant projects such as our current implementation in PEI, where the collaborative health record is presently being actively deployed as a provincial solution across the entire island. And all of the various primary care and specialty clinics in the community are actually being connected onto one instance of the CHR. So this means the opportunity to be able to share records while also being able to provide role-based and location-based access control. So depending on the nuances of your group, of your clinic, or your organization, you can delineate whether or not you actually want to have shared records in terms of access, or you want there to be kind of a glass door, if you will, that needs to be broken in order to be able to access those records. So I'll actually flip here briefly just to illustrate this. So if we look here in the top left-hand corner, I have the capacity to be able to change between locations. So again, one domain, multiple different locations. I could flip to that location, and by doing so, this changes my letterheads, the schedules, other pertinent information. It's almost as if I'm logging into that location. So incredibly powerful in the context of groups, networks working together within one platform, providing the necessary level of permissions accessibility that's required. And importantly, the CHR was built at its base to be able to evolve, to be able to iterate, to be able to improve. And as a cloud-based solution, specifically with the design built in modules, it has the ability to be able to update, upgrade, change these modules as they evolve over time. So for example, in the future, there may be the ability to be able to connect to other sources of data. Perhaps it's wearable data. This is just an illustration. The CHR can have the ability to be able to create new interfaces, to connect to other data repositories, add and enhance functionality as next technologies are made available. So things such as bots that can perform specific actions, or clinical decision support tools, or other repositories of data can be connected within the CHR, obviously with the appropriate permissions and access. And this really means moving away from this idea of really complex or barriers, or perhaps even inability of certain systems, such as locally installed systems that have a lot more hurdles to climb in terms of being able to evolve as technology moves quickly. So again, you have the assurance that with a cloud-based solution, you're able to evolve quickly as technologies and patient care evolves as well. And importantly, we've had the opportunity to work with leading healthcare organizations across Ontario, across Canada, and in many cases across the world as well, many of which are listed here, that have demonstrated that the CHR has the ability to meet the needs of mid to large sized organizations as well. So when we talk about FHTs or OHTs, we've worked with the province in Ontario. We've worked with large family health teams. We've worked with leading healthcare organizations in the US across multiple sites that require large volumes of data to be collected. This capacity, and I think these learnings also allow us to be able to ensure that it's not just the technology we have available to us, but also the tremendous amount of experience and wisdom that's resulted from the incredibly challenging work of change that results from moving from one system onto another. And I certainly don't want to downplay the effort that needs to go in to be able to do that. But I think having that experience and having that work under our belt allows us to be able to put our best foot forward as we're working with other organizations as well. So this concludes the formal part of the presentation here, but we did want to take a little bit of time at this point to answer questions. So I will rely on my colleagues here, Allison and Veronique. If there are specific questions, and those participants here joining us today, feel free to ask questions through the chat, and we can either walk through parts of the platform or answer those questions live.
Yeah, so thank you very much, Puneet, for a great presentation. So let me just have a look at the questions that came through the chat. All right. I like what it looks like. I like that it looks like everything is included in the core product and integrated. Are there any additional costs for any of these modules?
Yeah, so everything that you've seen is included. So it's all-in-one pricing. There are certain tiers there are additional things that can be done. For example, some organizations may want a custom patient app or white labeled application to be added as a service as well. So there's certain things that are outside of the core package, but it's been very important for us to ensure that a key value proposition with the CHR is that it's one pricing, one platform, and all of the functions that you've seen within that license tier.
Thank you. Let's move on to the next question. I find a lot of my patients hesitant to adopt some of these types of tools. Do you use all of the tools in your practice? If so, what has been your experience with patient adoption? What percentage of your patients use online booking and complete the assigned questionnaires? Was there a learning curve for your patients? So there's about 3 questions there. So just cue me in if you need me to repeat.
No, that's great. I'll go at it, starting with the first part of that regarding patient adoption and whether or not I utilize all the different elements in the practice. So I've used the CHR in multiple different jurisdictions: Woodstock, Ontario, so kind of a rural community, small town, London, Ontario, Hamilton, and now in downtown Toronto. And obviously, different patient populations, different geographies can lead to different needs. But I think the most important thing that I found in kind of using the system over the last 5+ years has been the fact that you kind of need to have the options available and then determine what's the right amount of engagement or the right tools that are appropriate for the patient in front of you. So for some people, they're completely comfortable with online appointment booking and questionnaires. They don't like the idea of patient portal. They don't want labs and things to be sent to them electronically. So there can be varying types of concerns for different individuals. But in my own practice currently, I'd say about 70 to 80% of patients are able to utilize both online appointment booking and questionnaires. And I think a lot of what adoption comes down to is not only understanding, obviously, that there's going to be different attitudes and different concerns with different populations, but also making sure that there's a value in return for the patient as a result of doing something. So an example would be for online appointment booking. So a lot of times people want same-day access. So one of the beautiful things that the CHR allows you to do is to be able to have, for example, online appointment booking available, let's say for certain appointment types, like let's say follow-up visits, but only for same day. So this means that if anyone, if there's a couple of openings in the schedule or a couple of cancellations, people are able to take advantage of that by being able to request those appointments online. So there's this access advantage as a result of being able to book online. Additionally, as a result of being able to share information through, let's say, a Q&A prior to a visit, I think one of the important things with doing that is that you have to acknowledge to the patient that you've reviewed that information, and that information is actually an important part of the visit. So when I'm seeing someone in person, for example, and even when I'm seeing them virtually, I'll narrate this instead of showing them. But I'll typically turn my screen with the CHR towards the patient, and I'll start by saying, thank you for completing that Q&A. It's allowed me to have a better understanding of what's been going on. Let's go through some of this information together. Now I'm looking at them, we're reviewing information. I'm not kind of busy having to spend the same amount of time typing or doing core history taking, and that transforms the way in which care is delivered. So I think when patients know that it's coming from you, from their healthcare provider, and it's that it's part of their care and it enhances the care, adoption goes up dramatically. That being said, of course, it varies from patient to patient, and having that conversation with them, I think, becomes an important part of what needs to happen. Hopefully, I answered all three components there.
Thank you very much, Puneet. So we do have another question here in the Q&A. So thank you for this demonstration. I'm tuning in today from a multi-service agency that houses a community health center primary care, visiting hospital services and community support services like Meals on Wheels, transportation, adult day programs, and more. My hope is attending today's collaborative health record webinar was that the CHR might be a tool that can take us from 3 different health records, which is the current reality, and be the Swiss Army knife of a health record that the system. From what I've seen today, the CHR seems very clinically based. Can you speak to whether the CHR has been used in multi-service based organizations that have primary care or other support services?
Absolutely. That's a wonderful question, and thanks for that. 100%. So the CHR and the versatility of the platform are really designed for a variety of different programs, be they focused on clinical delivery or really just peripherally involved in patient and health management. So we work with organizations such as CMHA Toronto. We work with the Region of Peel, Public Health. And so this means that we have, in both of those organizations, it's not, a lot of their programs are not traditional care delivery. They could be home care, they could be community housing related, they could be immunization clinics and so forth. So there's an immense amount of versatility to be able to support those, and we have a lot of experience in that. We've interacted actually a fair bit with community health centers, and I think there's a lot of value that the CHR has in being able to meet not only their care needs, but also on the reporting side. And CHCs often have a lot of reporting requirements and the need to collect some discrete types of data. And we have customizable templates to be able to support that as well. More than happy to, at a later time, we can have a deeper dive into the platform specific to the CHC needs.
Thank you. Next question.
Yeah, so I might take the next one. So one came in going to the reporting functionality. So I think someone has experience with the Insights I4C dashboard, the OMD dashboard. I'm looking to see whether this can be more customized in terms of creating your own search criteria. So I know that if you can kind of go through the CAN reports that are included, how we can kind of customize those to make our own reports from the application if it costs more money for the reporting integration. So a couple of questions there, kind of the CAN reports included, whether we can build your own within the application, and if there's additional cost for reporting.
Yeah, so thanks for that question. Reporting is configurable, and we're very familiar with the I4C dashboards, and obviously, CHR is OntarioMD certified, so we collect all the necessary data to be able to report I4C. But importantly, we can actually recreate the I4C dashboards within the CHR, arguably in a much more powerful way because of the fact that being integrated within the CHR, we can leverage things like mass actions, which I was referring to. So if you, for example, had a dashboard relating to congestive heart failure and based on a certain set of filters and subsets you wanted to communicate out to a segment of that population with congestive heart failure that was visualized on that dashboard, you could configure that and you could actually take action on that as well. So to answer the question, configurability is there. We can definitely leverage and build those tools. In terms of costs associated with that, typically there would be some hours of cost depending on the complexity of the reports. But as a starting point, we would want to know what the needs are. Maybe those are reports we've already built or we already have available to us. But we do certainly provide those professional and technical services as well.
And kind of sticking with the provincial assets, so there's questions regarding HRM and Connection Ontario and OLIS. Can you talk about how those are integrated back into the CHR and how it works into the CHR workflows and the dashboards?
Absolutely. So and I can switch over to the demo account to just show you. Now, the demo account is obviously not connected to those live, but we indeed have integrations with Health Report Manager as well as the Ontario Lab Information System. We're working closely with OntarioMD and Ontario Health to scope out and build out the next series of integrations on the basis of priority. But things like, for example, HRM. So HRM will come in through the inbox. So I know we didn't really have time to go through the inbox in detail, but this is where you have communication, you have the receipt of different types of things such as faxes, labs, files, messages, Q&A responses, and so forth. And here, this is essentially where OLIS information, not OLIS, HRM information would come in as a structured file. OLIS, as you know, functions on an on-demand basis. So within the CHR, OLIS is typically accessed through patient files. So again, this account doesn't have it here, but where it says add file, there's a button here that says OLIS. And you click on this and it opens the contextual launcher. And then it obviously pulls the data from, in this case, George's chart. And then it would allow you to pull information back into the CHR from OLIS. Hopefully that provides a brief overview.
Yeah, and a question, kind of same thing with integrations regarding Prescribe It specifically. Any news on or any information sharing the Prescribe It integration?
Certainly. So we are working with Infoway. We're currently in the stage of building and configuring the Prescribe It integration with the CHR. Exact timelines are still to be determined. But it is something that's on the roadmap that's currently being actively worked on. Importantly, the CHR does have workflows that make it quite easy to be able to send files, documents through eFax, at least in the interim. So you can see here there's the concept of the preferred pharmacy. So if I'm within an encounter, I'm able to really quickly actually, for example, do something such as renew a medication or add from, let's say, a favorite. I could click here, and with a single click here, I could sign and fax to the preferred pharmacy. So it generates the PDF, and then it would automatically pull in their preferred pharmacy's number, and I would send it out. The Prescribe It workflow would probably look quite similar. So obviously, we're hugely focused on minimizing the number of clicks, making it as intuitive as possible, and it's certainly on the roadmap.
Okay, great information there, Puneet. And again, I'm trying to keep up with the chat, so there's lots of questions keep coming through. Now we have about 10 more minutes to go, so keep sending them in. Again, Melissa and I are trying to stay on top of them, but hope you don't mind the rapid fire questions.
Yeah.
Next question regarding requisitions and referral forms. So in other EMRs, they have the ability to kind of create custom forms, e-forms directly in the application. Can you build requisitions directly in the CHR, or do they need to engage TELUS to build forms for the workflows?
Yeah. So we have a user interface that allows an organization to be able to build their own forms. We 100% allow for custom encounters, letters, forms, and so forth. So when we're talking about forms in the context of, say, something like lab requisitions, we have that here. And this is basically what you're looking at is the template editor. So you don't have to go through TELUS Health to build these. We, of course, provide the service of building these. And we, of course, have a library of these for different jurisdictions that are kind of growing and being updated. Importantly, when we're talking about forms, we also have this ability to build form templates. So, for example, let's say we're talking about the Ontario lab requisition for standard labs in Ontario. We could have a template for diabetes, hypertension, STIs, and you would define what gets selected, for example. So for STIs, I might want throat swab, urine swab, gonorrhea, chlamydia, so forth. And then when I load a visit and I select the STI template, it automatically populates that. So there's tons of automations. Sometimes there's small nuanced automations, but the idea is, again, to create smooth, streamlined workflows and to save the number of clicks as best as possible.
So any experience, any kind of transition that we've done previously and kind of how it worked out? Kind of along the same lines as if they wanted to kind of merge onto a CHR across their entire fit. Do you have any experience kind of taking multiple systems, multiple different groups and merge them into one kind of domain in the CHR? So just kind of comments on the overall migration into the CHR and how that has previously been done.
Absolutely. So we most definitely have migrated data from PSS, MedAccess, Oscar, Akiro, other EMRs onto the CHR. Our very first PSS data migration was last year. First time, as you can imagine, there are kinks that need to be worked out, but we've since then repeated it and are continuing to streamline that. An important thing to know is that data migration is a hugely important area of focus. We want appropriate data portability to exist so that users are able to the platform with the minimum amount of disturbance as possible, minimum downtime, and so forth. So these things are constantly evolving. Of course, PSS is also a TELUS Health product, so we benefit from having very friendly conversations with our colleagues and being able to build efficient channels for handling these sorts of things. To answer the second part of the question, what about multiple different disparate databases merging together? Absolutely. We have enormous amounts of experience with that, both in Ontario and outside, in terms of being able to combine different data sets. Obviously, it adds complexity, and I'm not going to downplay the fact that it's, in many cases, there's close work that's required with those organizations because quality assurance and verification of how to handle certain things requires involvement with the organization, which is the right thing to be doing. So as we get into more and more complex mergers of databases, there can be some more time and involvement required, but we absolutely have the ability to do that, and we're making more and more streamlined processes around that as well.
Okay, last question before I hand it back to Melissa for the closing. Question regarding whether the OHT digital health leads are in kind of aware of the CHR, whether they're kind of engaged with TELUS to kind of adopt this for their tools. So much of there's a lot of opportunities for digital health funding for patient engagement tools like online booking, patient portals, etc. So any kind of comments you can say about how to get the Ontario Health team leads more involved or kind of make them more aware of the functionality? Any kind of advice for the participants on how they can move forward with this?
Yeah, so I'll answer that question in a couple parts. First of all, we are absolutely very closely in conversation with OntarioMD, Ontario Health, in many cases directly with numerous OHTs. We're working with the eHealth Center of Excellence, working with other organizations. So they're well aware. Of course, OHTs, as we all know, are evolving, and there's many of them out there. So if there are individuals here that would require a demo or a deeper conversation regarding their OHT, and where perhaps we haven't had an opportunity to reach out to, by all means, as we conclude our session today, we'll be providing information on how you can get in contact with us. and we'd be more than happy to engage in that discussion. And even if it's just a matter of understanding what the system's capable of doing, how it might work for a particular region or configuration, we're very happy to do that.
Thank you very much, Puneet. So I believe this does conclude our webinar session. We hope, first of all, we'd like to thank you all for participating. We hope you enjoyed the presentation and found the information valuable. So if you have any questions, please feel free to write us at telussales.emrs@telus.com, or you can also visit our website, visit telushealth.com/health-teams. Have a wonderful evening, everyone.
Thank you, everyone. It was a pleasure.